I'm just curious to get your reflections, Brian, on terms of what you saw for the year that was coming at you and where you think we are right now.
Well, it's been a heck of a year, and I remember that interview, and we've gone through a lot. We've taken care of over 30,000 patients with COVID in that period of time here at the Atlantic Health System. We've worked through so many different challenges, but one thing that held true and reminded me when you were playing that back, we stayed focused on two things. One is making sure that we had access for our patients and we never had to close our doors. And the second was that we kept our team members safe. And those were our two priorities. But now that we are at this vaccination phase, we're putting equal emphasis on that, and we're pretty excited with some of the results that we're seeing there.
Yeah. Well, you were concerned a year ago, of course, about our lack of testing and how slow it was. Is there anything right now that gives you concern? Perhaps that too many people are not taking the vaccine or are not interested in taking the vaccine, or the variants a concern? Sort of where is your head at?
Sure. I can't resist talking about testing for 1 second. It's still a problem, just in a different way now. We've got to really work hard on making sure we understand the variants that are out there, and that's important. Regarding vaccines, we've been able to vaccinate about 64% of our workforce. In total, we vaccinated over 200,000 people at 11 centers that we have, including a mega center in partnership with Morris County and the state. And the issue right now is supply of vaccine. Now, in conversations that I've participated in with the National Vaccine Coordinator from the Biden administration and the American Hospital Association, as well as our state, we understand that we're going to start to see an increase of supply in a very material way over the next 4 or 5 weeks. So we should be at a point where we're not having to cancel clinics and we are able to get more and more people in. But again, we want to take care of about 10,000 patients a day, and we're at about 6,000 right now.
Yeah, Brian, it's Morgan. I mean, we just showed that soundbite. It was you and I sitting on set together, and my God, what a year it has been. That May 1st, I guess, marker to open up vaccine appointments to all Americans who want them. I mean, you just talked about supply, but in general, from an infrastructure standpoint, are you ready for that?
That's going to be very challenging as a country to be able to do that. I think in New Jersey, we're in reasonable shape to be able to do that. We've worked in partnership with the state government since the beginning of the pandemic, and that continued through this vaccine phase. And we started with the hubs that were associated with hospitals because those were the first priority healthcare workers. And now we've all increased those sites, and they're working very well. I've got one that's right outside the door from where I'm sitting right now. And it runs very, very well, and we have a lot of throughput there. What we need to focus on, though, are how to get this vaccine into vulnerable communities. And I think that that's where the real challenge is going to be, because there are people who can't get transport or are concerned about going to those sites. So we're starting now to work with churches and other community-based organizations. And we even have an ice cream truck that we're rolling out starting tomorrow, Tuesday, again, to go into communities and work with community partners to be able to get that vaccine. So I think that May 1st is a reasonable time to think that we could open up the queuing for the test.
Right.
Obviously, it's going to take a while to distribute that because our side alone, we have 800,000 people on our waiting list.
Shepard Smith here. Thanks for watching CNBC on YouTube.